Catherine, and I was diagnosed with IgA vasculitis 21 years ago. I received a kidney transplant from my dad 6.5 years ago, and we're here today to discuss the use of alternative therapies in patients with IgA nephropathy. There was a lot of discussion in the social media groups regarding this, and we're joined today by Dr. John Barrett, who is a renal doctor here in Leicester. Thank you, John, for joining us. So there's been lots of discussion in the social media groups around gluten and dairy-free diets. Are these beneficial at all to patients with IgA nephropathy?
So there certainly is a lot of talk about different types of diet as a way of treating IgA nephropathy. It's certainly something I get asked a lot. The bottom line is there's no evidence that any particular diet will protect your kidneys against further damage if you have IgA nephropathy. What I suggest to patients is if they wish to go on a gluten-free diet, they wish to go vegetarian or vegan, it's entirely up to them, and if it makes them feel better, great. What I can't say though is that this will make their kidney function any better. If they feel better, then why not carry on with that diet? So as you will see from the other video we've recorded, the most important thing in IgA nephropathy is to have a balanced diet rather than a particular diet that restricts a particular foodstuff.
So that's really interesting, and obviously it's so important to have a healthy and balanced diet. If we just go back to talking about gluten, can you just explain where the idea that gluten-free diet is beneficial for patients, where that's come from?
Yeah, so there is a rare association between having celiac disease, which is a disease of the gut caused by gluten, and developing IgA nephropathy. So IgA nephropathy develops in a very small number of people with celiac disease, and therefore that's really what started the idea that there was a link between the way the gut works and the development of the kidney disease. In studies that have systematically looked for celiac disease in patients with IgA nephropathy, there hasn't been a clear association found. So we don't recommend screening for celiac disease in patients with IgA nephropathy. There have been some laboratory studies suggesting that gliadin, which is the protein that causes celiac disease, may be found in the blood in patients with IgA nephropathy. But again, that data is not particularly strong. And in fact, a study from Italy some 20 years ago now put patients with IgA nephropathy, not with celiac disease, but with IgA nephropathy, on a gluten-free diet. And actually, there was no long-term benefit in those patients of going on a gluten-free diet. But clearly, it's very important that patients understand the implications of changing their diet and what they're likely to achieve and what they're not likely to achieve in terms of their kidney function.
And would that be the same for dairy as well?
Yes, so there's far less evidence to suggest dairy is associated with IgA nephropathy. And again, my advice to patients is to eat a balanced diet. No particular restriction of any particular foodstuff is going to impact on either the development of IgA nephropathy or the rate at which your kidney function gets worse.
So moving on from diet, obviously how important that is, and looking at the wider use of alternative therapies, if we think about herbal remedies, as this was something that was picked up by the social media analysis as well, is that something that could be beneficial to patients with IgA nephropathy?
Again, that's something that people ask me a lot. And there's no evidence that any form of herbal remedy is beneficial either to prevent IgA nephropathy or to reduce the risk of kidney damage with IgA nephropathy. And I think it's really important to stress that some herbal remedies can be damaging to the kidneys. And so we always advise patients, if they wish to take a herbal remedy, to speak to their kidney doctor, particularly if they wish to take Chinese or Indian traditional medicines, because some of these can contain compounds that are directly toxic to the kidneys. The other thing which may be surprising is as your kidney function slowly deteriorates, taking vitamin supplements is not recommended as well. And that's because some of the vitamins, particularly vitamin A, is removed from the body in your urine. And when your kidneys don't work so well and you're not able to pee as well, if you have extra vitamin A, that can become toxic and cause problems in the body itself. So we do advise to avoid herbal remedies, speak to your kidney doctor if you wish to take them, and particularly as your kidney function gets worse, is to be very cautious about taking any herbal remedies either from the high street or from an alternative healthcare practitioner. And while we're talking about therapies that can be bought online or on the high street, the other supplement that patients ask me about a lot is fish oil or omega fatty acids. So there have been some studies in the last 20 years looking at supplementation with omega fatty acids or fish oils in IgA nephropathy. And there did look like there was some early promise with those studies. However, repeated studies have failed to show any benefit. And so now if a patient asks me if they wish to take omega fatty acids, I tell them the evidence, which is that there's no clear data to suggest that this will slow the rate of kidney progression in IgA nephropathy. But again, those studies showed that this drug was harmless. And so if patients wish to take fish oil, then I don't stand in their way. What I do, however, is tell them how much was taken in the clinical studies so that they know how much they should take if they want to match the clinical studies where fish oil was shown to reduce the rate of kidney progression in IgA nephropathy.
Yeah, so if people are wishing to take alternative remedies, supplements, it's always best to speak to their doctor, their medical.
No, absolutely. But I think certainly coming back to fish oil, the one thing I would warn patients of is taking the odd capsule is not going to make any difference whatsoever. Yeah. If patients want to take the dose of fish oil that was used in the studies, this is a significant number of tablets and it comes with potential side effects. The two most common being excess wind and a fishy odour, which people will notice. So I think people need to be aware that even though you can buy it over the counter or online, these drugs are not side effect free. There will be things that people will notice if you are taking them.
So something that really surprised me from the analysis was just how many people were talking about tonsillectomy and how that could possibly be beneficial to patients with IgA nephropathy.
Yes, so tonsillectomy is a very unusual one. It's a practice that's followed very commonly in Japan. So if you have high-risk IgA nephropathy, it's recommended by the Japanese Society of Nephrology to have your tonsils removed and have steroids at the same time. So it's something that we don't do in the West, we don't do in Europe or North America, and we really have no evidence that removing someone's tonsils helps either prevent IgA nephropathy or slow down the kidney disease if you're known to have IgA nephropathy. There have been some small studies in Europe which have shown no benefit. And the evidence from Japan is really long cohort studies where they've looked at the outcome of patients over 10 and 20 years. And I think this perhaps speaks to what we don't know about IgA nephropathy. One of the things we don't know is whether the disease is the same in Europe and in Japan. And certainly there's lots of evidence that the disease may well be very different and therefore require different treatments. And so the Japanese very strongly believe that removing the tonsils is a positive thing, that it alters the disease and protects the kidney against further damage. We have no evidence that that works in Europeans, and therefore we don't do it. And I think that might suggest that there are differences in the way our disease behaves.
So that's really interesting, and obviously it just shows, you know, the analysis was from our UK Facebook IgAN group, but it just shows that people can get information, you know, worldwide from all over the world on different therapies and different treatments.
That's very true, and patients will equally be accessing our resource, hopefully, and they will be using that to help guide their treatment and to help them understand their disease much better. We did a little bit of work looking at Twitter accounts and Twitter discussions, and we fortunately had some Japanese Twitter discussions translated for us. And it's very interesting because there we found a lot of young people with IgA nephropathy sat in a hospital bed recovering from tonsillectomies, talking about things that we just don't see in the UK. And so I think it's fascinating being able to compare the experience of people's disease in different parts of the world, seeing what's common about that experience, but also seeing what's very different, because I think we can learn a lot from that.
Definitely. And it must be quite hard if you have patients coming to you saying, well, you know, they do this in another part of the world, why don't we do it here? It must be quite hard to address that sometimes.
Well, no, I think our job as a doctor is to give patients all the information they need to make sensible decisions about what treatment they would like to have. And also, very importantly, to dispel any myths there are that certain treatments will work for them. Because I think it's very important that we make sure we give the right treatment and that we don't give the wrong treatment. And certainly if a patient wishes to take control of their disease, which we very much encourage, and they want to alter their diet, alter their lifestyle, then we are very much supportive of that, as long as we explain to the patient what they will hopefully achieve and what they potentially might not achieve by doing that.
So what's the most unusual alternative therapy that a patient has ever asked you about?
Yes, well, that's a good question. So patients have asked me about hyperbaric oxygen.
Wow.
Which, well, precisely, I had to go and look it up. It is where you are treated with high concentrations of oxygen, often in a tent. And the only time I've ever seen that used is Olympic athletes who use that for conditioning ahead of sporting events. There is absolutely no evidence that this works in IgA nephropathy. It might make you run faster, but it's certainly not going to make your kidneys work any better, as far as I'm aware. The other thing I just want to bring up, and a lot of patients come to see me because they really do want to get their kidneys working again, is whether they can have kidney stem cell treatment. In theory, that is a fantastic future prospect, but at the moment it is not a realistic option at all. And I just want to warn patients who may see adverts, they may see suggestions that this is available in other parts of the world. This is not a treatment. This is not a recommended treatment. It may well become a recommended treatment in the future, but it is not something that is available safely and tried and tested at the moment. And if you are considering that form of therapy, you must speak to your kidney doctor first.
Thank you very much, John. It's been really informative and really interesting. We hope you've enjoyed watching the video today about alternative therapies. If you need any more information, you can always speak to your medical team. Thank you very much for watching.